Hello, everyone. Welcome to today's webinar. My name is Misha Kuze, and I'm the Associate Director of Education and Training and Medical Science Liaison here at L-Nutra. Our presenter today needs no introduction. Dr. James LaValle is an internationally recognized clinical pharmacist, author, board-certified clinical nutritionist, and expert and educator in integrative and precision health. Dr. LaValle is best known for his expertise in personalized integrative therapies, uncovering the underlying metabolic issues that keep people from feeling healthy and vital. A thought leader in drug nutrient depletion issues, Dr. LaValle has published 4 books and 3 databases in this area alone. As such, Dr. LaValle has over 35 years of experience integrating natural and integrative therapies into various medical and business models. His latest research is in drug-induced microbiome disruption. I am very pleased to share that Dr. LaValle is a L-Nutra consultant and will be presenting today's talk, sponsored by L-Nutra, on the science and clinical application of the fasting mimicking diet. Thank you again for joining, and please make sure to submit your questions for Dr. LaValle through the Q&A feature in Zoom. Dr. LaValle will make sure to address them after his presentation. Without further ado, I present to you Dr. LaValle.
Hey, everybody. I hope you've all had a great day. Tonight, we're going to go over the fasting mimic diet, its science and application, and I think you're going to find it to be incredibly interesting. And I know I just find it to have just incredible impact on our clients and our facility. So please bear with me while I read this. This is the FDA disclaimer. This presentation is not intended for distribution. This information is provided for the use of physicians and other licensed healthcare professionals only, and is intended to be used as a basis for determining whether or not to recommend this product to their patients. This medical and scientific information is not for use by consumers. The product offered by L-Nutra are not intended for use by consumers as a means to cure, treat, prevent, or mitigate any disease or other medical condition. Once again, this presentation is not intended for distribution. It contains statements that have not been evaluated by the FDA. FMDs are not designed to diagnose, treat, cure, or prevent diseases. So let's get started. So fasting, obviously, it's been a part of human evolution. It's across all species, actually. It was a part and continues to be a part of traditional cultures across time. And it either was formerly practiced or currently practiced by all the 5 major religions. And obviously what's happened with modern growing methods for food and plentiful food, that fasting was replaced by patterns of uninterrupted daily food intake. So simply put, as I always say, people today, we eat too much, we eat too often, we eat too late, and we eat between eating. And that can add up to issues with why we have such problems with management of metabolism and weight. So fasting is back now. People are talking about it. It's all the buzz. And so if you look at this, fasting and fasting mimic science helped drive the fasting category to the #1 diet and nutrition in the United States, both in May of 2018 and 2020. And then if you look, intermittent fasting was the most common diet followed by Americans in 2018 and 2019. It took second place to clean eating, but then clean eating took second place to intermittent fasting, and then subsequently in the year 2020. And then additionally, the number of Americans following a diet in 2020 has increased from the previous year. And let's face it, wouldn't it be great if people considered intermittent fasting and clean eating together? And if you look, 43% of people followed a diet in the last year. That was up from 2019 at 38%. So obviously, people are interested in diet and what to do in order to feel good. So what is fasting? So there's a common definition for fasting, which is abstaining from all or some kinds of food and drink. And then there's the physiologic definition, where you switch from burning glucose for energy to burning fatty acids and ketones as the main source of fuel, which is a more efficient use of energy. And then the molecular definition, which we'll get to in just unpacking that a little bit in a minute, is the absence of triggers of nutrient sensing pathways, which then stimulates uh, stress resistance. So when you look at this and you look at the three phases of fasting, obviously glucose and fat are the main sources for fuel. And when glucose isn't available, we flip the switch, right? We go to fat being metabolized as fuel in order to spare protein. And basically within 12 to 24 hours of fasting, it leads to producing uh, fat derived ketone bodies and free fatty acids that are then used as energy. And if you look at this, you can see in the first phase, you see the glycogen pools deplete in yellow dramatically during that first 12 to 24 hours. Metabolic rate also starts to come down. And then we look at specific weight loss actually starts to really gear up as we get into day 3. And then, of course, the use of protein and urea also spikes up as we enter into day 3. And, of course, glucose is trends on its way down precipitously as we get into day 3 as well. And the importance of this, it can't be underestimated, especially when you look at the issues that I know I deal with personally and practice every day. But if you look at this particular study that was in the New England Journal of Medicine in 2019 by DeCabo, and then, of course, Dr. Longo in Cell Metabolism in 2014, there's a variety of different targets that get impacted by fasting. And this is the physiology of water fasting and the adaptive responses that occur in the body to water fasting. So the first piece, obviously, if we look at the top right, is that it increases parasympathetic tone, downregulates heart rate and blood pressure, and improves or increases heart rate variability. I think if you're up on kind of the whole neuroimmune endocrine signaling relationships that occur, this is a key shift to the benefit of individuals because most people are running in sympathetic dominance. Their heart rates are typically, at least for a lot of people that I see, maybe above 62, which of course, for every 4 points above 62 represents a 7 to 10% increased risk for cardiometabolic diseases. And then, of course, with fat, we increase lipolysis or the breakdown of fat. And with that breakdown of fat, we have more autophagy and a down regulation of mTOR. We'll get into that in just a little bit, which the net of that is it increases stress resistance. The other piece that's important as we continue across this cycle is looking at muscle and seeing that we get a change in insulin sensitivity. We get an improvement in insulin sensitivity, which is, of course, a major win for people's metabolisms, especially today with so many people that have insulin resistance. So being able to improve insulin sensitivity is big. And then, of course, from the GI tract, we see a decrease in cell proliferation and a decrease in energy uptake. And then from the liver, we see an improvement in glycogenolysis, as well as a decrease in IGF-1. And then the last piece, which of course is incredibly important, is for the brain and increasing enhanced network plasticity or signaling capacity, right? It's better communication. Now, these physiologic changes have not been fully verified by using fasting mimic diet. So I just want to be clear that this particular slide is based on water fasting. So when we look at the cellular and molecular effects of fasting, if you look at macronutrients, high good fats, low proteins, low specific carbs, in combination were studied for their ability to nourish the body and create a fasting state while not triggering the 3 key nutrient sensing pathways. So the 3 key nutrient sensing pathways consist of the PKA pathway or your carbohydrate pathway. And then if you look at the IGF-1 pathway, which is the protein pathway, and then, of course, the mTOR pathway, which is the pathway with utilizing amino acids. So the net of this with dietary restriction is that it enhances what's known as stress resistance, which then triggers a host of other processes. Now, this isn't to say that when you break your fast that your IGF-1 levels don't go back to at least, somewhat of a normal level. But the point to this is what you're trying to get to is this initiation of stress resistance. So if you take a look, if you look at normal high food intake where, whether it's, excessive protein intake, too much sugar, too many carbs, then the net of that is, activation of, growth of cells and cellular aging, and remember, these are things that are in excess, which is actually pretty common. Then if we look at fasting or in fasting mimic diet, and in particular with fasting mimic diet, which is a 5-day, program or length of duration, or fasting, which typically is 3-day length of duration, your net goal is to block that insulin pathway, to blunt IGF-1 and mTOR, inhibit the PKA pathway so that we can trigger this stress resistance response. And of course, by doing this periodically, we end up inducing more of an approach of healthy aging. So, probably the most important aspect of why fasting is so applicable is this is the 2016 Nobel Prize on the discovery of autophagy. And, think of that is that, the Nobel Prize was just awarded, just 5 years ago regarding the information around autophagy. And so when you have poorly functioning organelles like the mitochondria or misfolded proteins, during autophagy, those are targeted for destruction. So basically what it is, it's a way of your body doing, it's cleanup, it's cleaning house, it's sweeping up the waste debris, allowing for a recycling effect. And it's this whole concept of autophagy is important because it helps with managing inflammation, keeping immune homeostasis, as well as being able to trigger cellular rejuvenation or cellular renewal, all of these things triggered by prolonged fasting. And if you're familiar with inflammasomes, which of course are activated under chronic metabolic inflammation, one of the key things that helps to neutralize kind of runaway inflammasome, NLRP3 inflammasome activity, is triggering autophagy. Autophagy is kind of the other side of the seesaw to inflammasome activity. So this was pretty significant finding. So, not all fasting is the same. And so that should be noted. You've got intermittent fasting of less than 2 days, and there's a lot of ways that that's done. So you have people that do time restricted eating, either, 16-8, meaning 16 fasted, 8 eating, or more of a circadian method of intermittent fasting, which is a 12-12. And honestly, every variation in between. Some people do 14-10. But the goal of this is just simply to, I think the benefit to time restricted eating for everyone is that it starts to restrict how much they eat. Although on the 16-8 fast, sometimes people might try to get in a little extra during those 8 hours. Whereas with circadian eating, it's a little more time to normal meal planning. There's also the 5-2 method of fasting, where on the 2 days where people are either fasting or taking their calories down either to 500 calories if it's a female, or approximately 600 to 800 calories if it's a male. And that would be 5 days of normal eating, 2 days of this either heavily reduced caloric intake or complete water fasting for those 2 days. Not a lot of downside to that, but it still doesn't quite get us to the goal of autophagy. So the other type of intermittent fast is the alternate day, where every other day, basically, you go from a normal caloric intake. And once again, that's an interesting concept, because I know from, doing work with my contract research organization in the past, people that would come in that were overweight, their normal intake, they would think was 2,000 calories and they were taking in 4,000 calories. So it's important to understand that there's variation in that, but every other day would be, 1 day of a normal caloric intake. And then the other day, there's a couple different ways that that's done. Once again, either at approximately 500 calories a day for women, 600 to 800 calories for men on the alternate day. And then there's prolonged or periodic fasting of more than 2 days, as in a water fast. And then there's the fasting mimic diet, which is actually fasting or getting the fasting effect with food. And so prolonged fasting does have its challenges. So when you try to do water for 4 to 5 days or longer, first of all, adherence is tough. And then, I mean, for me, I never recommend it unless I know someone's going to be in a facility where they can be watched and overseen, because people get dysglycemic, and that can create issues. So that leads to safety issues. Are they dizzy? Do they pass out? So water fasting without clear supervision, I think, is an issue. Whoop. And let me go back. And then, of course, there are the side effects to the right. So gallstones, dehydration, hypotension, as I said, dizziness on standing, hypoglycemia, loss of muscle mass can occur, nutrient deficiencies, obviously, with complete fasting. For example, you'll typically lose, after that second day, you'll lose a lot of your your cysteine pool, which of course is important for detoxification. And then, of course, people get hungry. And so, prolonged water fasting has its challenges. So Dr. Longo, Walter Longo is a biochemist and cell biologist, and he's the director of the Longevity Institute at University of Southern California. And, he made his, I think, incredible life's work studying this aspect of longevity, which is bridging these important pathways that are recognized to regulate aging and age-related chronic diseases, and then applied that knowledge of what's going on at the cell biology level to develop the first diet that actually mimics fasting. I have people ask me all the time, well, can't you just do this with food? And I think that you have to do is you have to appreciate the amount of research that went into developing this program. So for example, 20 plus years of research and development. There was foundational preclinical work. There was completed, existing, and pending clinical trials at the University of Southern California, the Buck Institute, University of Genoa, and the IFOM. And there's $48 million in total research grants, $36 million from the National Institute of Health and European Union for Aging, Fasting, and FMD research, and then another additional $12 million in additional funding for FMD clinical trials. So the first thing is, there's a tremendous amount of research that has been done on FMD and what its effects are in humans. And so this is the fasting mimic diet program for the professional. And if you notice, you get a complete kit for 5 days. And elegant, easy to use. I have to tell you, what I find when I show people the Prolon kit is that they just say, yeah, I'll try it. I mean, when I first got it into my practice, I thought that it was going to be something I'd have to really, go in depth and take a long time to explain it. And really after just, qualifying them and thinking that it's right for them, and showing them what I wanted them to do or to try, it was very easy for them to adapt to this, because it tells you exactly what to do for those 5 days. There's no questions about what to do. And so when you think about how fasting mimic diets work, you look at a traditional Western diet, of course, the issue becomes that when you're eating to excessive carbs, excessive protein, excessive sugars, we're unable to trigger our nutrient sensing pathways, and we're not able to trigger the rejuvenation pathways. So what happens is we don't necessarily trigger autophagy. And when autophagy is not present, the old, worn out intracellular components can't be recycled. In other words, you can't clean house within the cell or in tissues because you always have this stimulatory pathway turned on. When you look at fasting fasting drops down the nutrient sensing pathway and the intracellular cleanup starts to occur. So you induce autophagy. And remember, as I said, autophagy, when you read about autophagy, you begin to understand that it's incredibly important in helping to regulate that inflammatory pathways in your body, i.e. the inflammasome pathways. When you look at FMD, you get the same effect with intracellular cleanup or autophagy. So this is a way that in a 5-day eating program, you're able to mimic the effect of a water fast on autophagy, but at the same time be able to eat food. So you're literally getting the fasting effect while eating food as it relates to intracellular cleanup. And that's because you don't cross that barrier of nutrient sensing pathways with the way the macronutrients have been designed. And that was the 20 years of research that it took with Dr. Longa and all the incredible team of researchers with him that they figured out the correct macronutrient blend that allows for this process to take place. So it's a 5-day structured plan. I think that's why it's easy for people to do it. It's a very unique nutrient ratio. That's where the key is. That's where the magic is. It's where it delivers the benefits, similar to a prolonged fast, many of the benefits. Scientifically formulated, it's a plant-based ingredient to mimic fasting. So, plant-based. Formulations have been shown to be effective through the research, provides nutrients to avoid malnourishment, and it's been demonstrated to be safe with over 220,000 user experiences, and safety profile has been carefully tracked in individuals. So what's the composition of Prolon? So with the Prolon Professional, if you look to the left, on this side, we see there are 83 ingredients. And the other things that are different is that there is low inulin and low grains. There's newer soup recipes, and it includes no nightshades. And then, of course, there's a vegan dark chocolate tablet as well. So if you look, some of the key differences on Prolon Professional: no nightshades, more ingredients, low inulin. And in our population of folks where they've got a lot of dysbiosis and they complain of bloating and GI distress, I think that I really appreciated when they came out with, from at least my personal experience, the no nightshade, lower inulin formulation of Prolon. And of course, the protein restriction is equivocal, 9 to 11%. There are nut-based fats and omega-3 fatty acids at about 44 to 46%. The complex carbs and fiber come in at 43 to 47%. It's a mild caloric restriction. So you're, for 5 days, you're between 700 to 1100 calories a day. And if you remember in the days of, HCG diets, for example, people would be restricted to 500 to 800 calories for, 3 weeks. So this is not a insurmountable task to occur when you've got, 700 to 1100 calories a day for a 5-day period of time. They're vegetarian and gluten-free. It's also lactose-free. And then there's micronutrients in both the Prolon Standard and Prolon Professional, so that you've got, and then of course, plant-based ingredients, 10 more ingredients in the Professional. And the glycerol, of course, helps nourish the body during the fast as well. So if you look at the key features, once again, the Prolon Professional Standard is the original Prolon that everyone's grown to love since 2016. It's got the original soups: tomato, minestrone, quinoa, vegetable, and mushroom, and has fewer ingredients. And then, of course, the Professional, as I've already kind of emphasized, but just to go over it again, inulin is reduced, so less chicory root fiber, reduced grains, a nice new vegan dark chocolate tablet that people look forward to, and that helps restore the ratio of fats due to the new formulations in the soups. So there's even a scientific reason for putting in the vegan dark chocolate tablet, so that it corrected the ratios so that they were equivocal to the research. And then 5 new soup flavors, which is fantastic, and 83 ingredients. The one thing I will tell you, if you haven't done Prolon Professional yet, is just make sure you tell people to follow the directions on the soups. You know, some need to be heated on the stove versus being put in a microwave, for example. So just make sure they follow the directions on how to reconstitute the soup so that they can be as tasty as possible. So when you look at the 5-day journey with Prolon, we see that, you know, the body transitions into a fasting state and fat burning mode. So it starts cellular cleanup. That's day 1. So at day 2 on Prolon Professional, you see that fat burning ramps up. It contributes to the initiation of ketogenesis and ketone production. And by the end of 48 hours, you may get ketosis. And then day 3 is when the autophagy or cleanup begins. You get enhanced fat burning, ketone production and utilization continues and increases. And then day 4, it's kind of interesting. People will report on day 4, they feel fantastic on it. And they almost euphoric. And so it's, you know, cellular cleanup and rejuvenation continues, fat burning and ketosis continues. And then of course, on day 5, when we get into cell renewal, this is where we get sustained cellular recycling and rejuvenation and renewal of sustained ketosis. And then you ease out on day 6. Now, the one thing I want to warn you guys about is a lot of times people look at that day 5 is, I can't wait till I have a hamburger and fries on day 6. It's really best to try to get people to eat healthy and ease out of their 5-day Prolon fast, because they'll get additional benefits if they kind of break that fast by eating some steamed vegetables, maybe a salad, maybe soups, maybe some fish. You know, kind of ease out of your 5-day program. I think you'll find that people will get even more gratifying results by doing that. I think you'll find the satisfaction scores that we're going to go through in just a little bit to be nothing short of amazing, in my opinion. So when you look at the qualitative difference between fasting mimic diets and, of course, a very popular diet today, ketogenic diet, you get high good fats, low in proteins, low in sugar. And then with the ketogenic diet, it's high in fats, normal proteins, but very low carb. The duration on fasting mimic diet is 5 days. And as you'll see, it's suggested to do it 5 days for 3 or 4 months, depending on the situation that you're applying it on. But it's 5 days basically out of every 30 days. And then those other 25 days, they return to a normal diet. And hopefully you'll be instructing them on, you know, following something similar to a Mediterranean diet or modified low carb, plant forward diet, something like that. Versus a ketogenic diet, which can last several weeks to months. And I know a lot of you have had people that have went on ketogenic diets, they've lost weight, but then they fall off and then they have issues with weight gain. So, you know, that several weeks to several months can be challenging in some populations. The fasting side designed to mimic physiologic and cellular fasting. And the ketogenic diet is designed to mimic just physiologic fasting. And then, the fasting initiation is quick with FMD. It's time dependent on ketogenic. If you look at the cellular effect of that rejuvenation effect of the cells, the autophagy and the cell renewal on FMD, in ketogenic diet, most likely there is a sensing of nutrients due to the fact that there are some proteins being taken in. Lean body mass is protected with the fasting mimic diet. And remember, FMD is for 5 days, whereas with the ketogenic diet, it could be protein dependent. When you think of the positioning of each diet, one for healthy weight management, metabolic efficiency or improving metabolic health, and of course with that target of longevity, aging, in a positive way. Whereas with ketogenic, it's more weight, some metabolic benefits, of course, and then of course the data on ketogenic diet and certain neurologic situations is out there. So let's go to the Prolon. It's really the first to market fasting mimic diet. Obviously, breakthrough discoveries published in 28 or more of the top scientific and medical journals. There are currently 30 ongoing trials. It's actually 30 plus. I don't know the exact number because they're adding them all the time, but there is at least currently 30 ongoing clinical trials looking at FMD. And if you look at the anthropometrics, these are the obvious things. I think I would point to not just the body weight, because it does show healthy weight loss, a decrease in BMI, abdominal fat reduction. I think it's great the way it targets in this 5-day period, tends to target fat and the maintenance of lean body mass. So this is when healthy individuals are undergoing 3 monthly cycles of Prolon. So as I said, 5 days on, 25 days off, 5 days on, 25 days off, and the third month of 5 days on and 25 days off. Much easier than thinking about trying to hold on to a specific diet, maybe like a ketogenic diet for months and months at a time. And so if you look at this as healthy aging, metabolic balance, in this particular study, it's healthy individuals undergoing 3 monthly cycles of Prolon. So the deactivation of IGF-1 triggers cellular cleanup in the form of autophagy, which supports rejuvenation and healthy aging. Now, that being said, the first question people ask me is, I thought IGF-1 levels were good. Remember what you're trying to do here. You're trying to create almost a teeter-totter effect, meaning that you're bringing this down for a short period of time, for 5 days out of the month, in order to trigger autophagy, clean the cellular debris up, support rejuvenation of tissue, and help with healthy aging. And then obviously at day 6 and beyond, IGF-1 levels, they become, I like to think of it, and this is just my personal opinion, that you're getting more of an appropriate IGF-1 response versus, say, for example, with a typical diet where people were eating excessive proteins or just eating too much all the time, probably triggering too much IGF-1. And then, of course, on metabolic balance, the maintenance of healthy systolic blood pressure was apparent with FMD. So that was great. And, when you look at all these different markers that were in this study on the healthy individuals undergoing a 3-month cycle of Prolon, this was really done to show the safety data. The Prolon was not associated with any dangerous drops in biomarkers, and so that the safety data was very clear, that there wasn't any straying or odd, incredible plummeting of markers that were inappropriate. And this is, to me, was a fantastic, data find, right? If you look at this, sustained impact of fasting mimic diet cycles for basically 3.2 plus or minus 1.3 months after 3 FMD cycles. So how much of the benefit does someone hold on to 3 months out, basically, after they finish their 3 cycles of Prolon? So if you look at their waist circumference, the average retention was a 60% loss, or 60% of the benefit was sustained basically at that 6-month point, 3 months on and then 3 months off. Systolic blood pressure, 55% retention of the benefit. Body weight at 64% of retained benefit, and BMI at 71% sustained benefit. I mean, that's pretty amazing when you think that was only 15 days out of those 6 months. And this is the type of benefit that was retained. So it's interesting how it has this lasting effect on metabolic health. So when you look at the compliance, so the compliance is 71% compliance within 3 cycles. So you can see where some individuals dropped, scheduling were issues, a couple of them were personal issues. So if you look at the exclusion, most people were able to complete it. I think the even more important information is here on the right-hand side, where it got easier each time. Whoop, I don't know why that happened. If you look here, we see that, mild fatigue, less and less with each cycle, mild headache, less and less with each cycle, and mild weakness, obviously, also going down less and less with each cycle. Remember, people are dropping their calories pretty significantly during those 5 days, so they may experience, a little bit of fatigue. And some people, I haven't had many people complain of mild headaches myself in our practice, but it does occur and it's reported. And then, of course, the mild weakness, of course, because you are dropping it. And once again, remember, it would be recommended that you don't exercise, don't try going out and lifting weights or running your 5 mile run when you're doing your 5 days during this time. That you may resort to just maybe a walk or something of that nature. So when you look at this for 5 days each month, it provides many of the benefits of an everyday heart healthy diet when done over a few months. So multiple cycles of a 5 day fasting mimic diet, it has multiple ways that it supports individuals' health. So one is it helps their metabolism. It supports metabolic health. It supports cardiovascular health as a part of a healthy lifestyle. So remember, we're not telling people those other 25 days, hey, eat whatever you want. We're trying to teach them to have a healthy lifestyle, better eating selection, better timing of their meals, exercise regularity, getting good sleep, right? All part of a healthy lifestyle. And then helps to maintain at least 5 to 8 pounds of weight loss, and as well as reducing visceral fat. And then helps with reduction of waist circumference, an average of 1.6 inches. And look, if you can have somebody lose almost 2 inches off their waist, typically they're pretty happy. And then helps to preserve lean mass, and then supports healthy aging via the autophagy initiation. So cell rejuvenation, cellular debris cleanup. So this is the part that I think is fascinating. And I have to say that I have found this to be true. So when L-Nutra put this data together based on their survey, I absolutely agree with their findings here. Just what I have found as well is that they're motivated to adopt a healthier lifestyle. They feel better and therefore are more motivated. They're more mindful about what they eat. 80% of people, so 8 out of 10 people, after they do this 5 days, will start to become more mindful about what they're eating. They start to take more control of their health, 77%, and then establish healthier eating habits, 70%. This is like a boot camp for behavior modification, right? At the end of 5 days, they're adopting so many different changes in the way they think of food and how they eat, and their motivation to take care of their health. I think it's fascinating. And then, of course, its impact on behavior and emotional well-being. This is more of that survey data. Less food cravings when the fast was completed. Improvement in mental clarity and focus. I got to tell you, most of the time people start to say they see that at end of day 3 and especially through day 4. And 61% of people will say they have greater energy level. So this is just excellent in the course of 5 days. And then when we look at this, better portion control. Without a doubt, people come out of Prolon and go, you know what? I think I was eating more than I thought I was. I was eating past the portion size I needed to. 69% of people have better portion control. Less food cravings after the fast was completed. That's 67%. And then able to resist sugary foods better at 65%. And then once again, that improvement in energy was already reported. So what are the tips and precautions on Prolon? So who's it for? Well, first, it's for people that are looking for weight loss, people that are interested in longevity or healthy aging support. I think for a lot of folks, their attention is really moving towards that healthy aging aspect of programs that we're offering people. Also to support metabolic balance and for cardiovascular health support. And then when not to use Prolon. Well, first of all, if you're allergic to nuts, oats, sesame seeds, or any other component within the Prolon kit, obviously don't use it. And do not fast if you're pregnant or breastfeeding, if you have symptoms or treatment for an active infection or risk of a recurrent infection, if you have a BMI of less than 18.5, or pediatrically if you're less than 17 years of age. So how do we optimize the patient experience? So first of all, some people could experience, as we talked about, hunger, headache, fatigue, nausea, which I haven't seen much of that, difficulty in concentrating or feeling cold. And what are the solutions? First of all, light physical activity. I want to emphasize light physical activity. One of the reasons you wouldn't want to, lift weights is that triggers mTOR, and that's what you're trying to push down to trigger autophagy. So stretching, yoga, walking, all good. Try to rest a little more. Hydration could be an issue. Hydration could help with the fatigue and the headache. And then if people are used to drinking coffee or taking in energy drinks or taking in caffeine, that they could incorporate 8 ounces of coffee per day. And of course, if they need to, they could use over-the-counter medications to manage their headache or to manage their nausea if they need to. But that's a last resort. Hopefully, what happens is that the physical activity, the rest, the hydration, and or the coffee will take care of it. I have to tell you that I don't know. Once again, my personal experience in using it within our clinic, um, 95% of the people do really well with it, and we don't run into too many problems. However, I know if I have someone who's hypoglycemic or they're particularly sensitive to blood sugar drops, I'm usually working on that and trying to get that to improve a little bit before I would have them experience or try to do a Prolon. So we try to work those things out and get them stable before they do it. Disclaimers on medications. Please bear with me as I read this. The following non-exhaustive list is based on feedback from experienced medical professionals regarding the use of Prolon with patients using certain medications. Prolon has not been clinically tested with any drug or disease. There are no published clinical trials utilizing Prolon in combination with any medication or disease state. The following information is based on the feedback and opinions of healthcare professionals who are experienced and knowledgeable in the use of Prolon in a diverse patient population. For the purpose of this information is to facilitate discussion of some of the more common safety concerns and real-world use cases of the product for general wellness purposes by healthcare practitioners with the understanding that Prolon is not indicated for diagnosis, treatment, cure, or prevention of these medical conditions. And note, each patient is unique and should be evaluated by his or her unique health needs by you, the healthcare professional, prior to recommending Prolon. Medication considerations. Fasting may contribute to the following: hypoglycemia. So you have to monitor and adjust any hypoglycemic agents. Electrolyte imbalances. So dehydration or hypotension. So monitor and adjust any blood pressure medications as needed. And then hormone fluctuations. Thyroid, sex hormone replacement, steroids, dependent on the patient. Always ensure the patient is on a stable regimen prior to fasting and FMD. I haven't seen big swings on the hormone fluctuation. We obviously try to keep people hydrated. You also get there's a multivitamin that they take each day to help make sure they're getting nutrients. And then once again, as I mentioned earlier with hypoglycemia, if they're on multiple medications, you just have to monitor them closely. So other medication considerations as a food, because remember, this is all food. It's not known to interfere with any common medications. So statin, aspirin, NSAIDs, proton pump inhibitors, acetaminophen, allergy medications, non-drowsy allergy medications, there's no interference with those. And it would make sense because you're simply eating food. Precaution, once again, it's not designed to diagnose, treat, or cure or prevent any disease state, and each patient should be reviewed by the provider and medications continued for treatment purposes. Due to the restricted calorie nature of fasting and thus FMD meal program during the 5-day regimen, patients should drink at least 32 ounces of water to minimize the risk of dehydration, in addition to the fluids consumed by following the diet as instructed. So remember, people are going to be eating soups and they get fluid. People are going to be drinking their drink. That's why you get that water bottle and you put the glycerol in it and you fill that water bottle so that they're getting that water with the fluids. And in addition to that, 32 ounces of water. And as I stated earlier, strenuous exercise or exposure to high temperatures like saunas, spas, or jacuzzis, or cold temperatures should be avoided. And for a better experience, so herbal teas, unsweetened and caffeine free. If you notice, you do get herbal teas in the kit. I actually put one in the glycerol water and flavor it. And that's what I recommend to our patients. But you have herbal teas that they can drink. You don't sweeten them. You can have up to 2 pieces of sugar-free gum per day, 2 slices of lemon, squeezed, not eaten, but squeezed. 1 teaspoon of sea salt, as long as there's no other health contraindications. You can use that, of course, in the soups if you want. A tablespoon of dried herbs or spices to enhance the flavor of the soups. And then all types of sparkling waters are fine as long as there's no sweeteners in them. And remember, caffeine up to 90 milligrams per day. That's 1 cup, 8 ounces of coffee, no cream or sweetener, or 2 cups of, or 16 ounces of black or green tea steeped traditionally, no matcha, or 6 cups of decaf coffee with no cream or sweetener. And how do you do it in your practice? Well, the first piece is try to consider what your patient's healthcare goals are. And I think if you talk to their goals, it can make it more effective. So this should be able to help you a little bit. So have a personalized approach. It's what I do with everyone. Is I try to meet their needs with a program that will fit their goals, right? And I think for Prolon, it helps me in so many ways with individuals achieving their goals, especially if it relates to aging in a healthy way or improving metabolic health or metabolic balance. And always be sure to assess each patient. Make sure that you have a great implementation strategy with them, and then support the patient by scheduling an appointment after 1 or 3 cycles of Prolon. I have people come in once a month for their first 3 cycles because I'm wanting to know how they're eating on their other 25 days. I want to reinforce the positives of why they're doing Prolon. I want to track their success. So I personally end up doing a once a month visit with them during the first 3, or if I go to 4 cycles of Prolon. And then utilize resources. There's a medical education team. It can provide you with training. It can address questions and concerns. It keeps you up to date on the field of longevity and fasting. And of course, there's health coaches that are available as well to motivate your patients that are on Prolon. So take advantage of the resources that L-Nutra has put together for you to be able to make utilizing Prolon in your practice successful. So if you look at this, the healthy aging protocol is 3 cycles. If you notice, weight loss supported healthy aging is kind of what that goal is. If you look at the bottom metabolic health protocol of 4 cycles, or when you're looking for additional weight loss and metabolic health benefit, you go to 1 more box in month 4. If did they achieve their goal? If they didn't achieve their goal, they can do 1 box for the next 1 to 3 months. Once again, 25 days off, 5 days on, and that's easy. If they achieve their goals, they can do 1 box every 3 to 6 months. Why would you want to do that with them? Well, because autophagy and cleaning up cell debris, it's a great way to rejuvenate and revitalize an individual's metabolism. So it really helps with metabolic health. If they didn't get it and they're on the metabolic health program, you have them do it 1 box for the next 1 to 2 months, then reassess. And look, for all of us at A4M, I know we're reaching into our toolkit and doing a lot of other things for individuals during the course of their month. So typically, I think we see people reaching their goals, and that this is just a great way to really enhance that cellular rejuvenation process. If you look at just simply a reboot, and if you look and they do it, does your patient have weight and metabolic goals? Yes, then that's where they go into the reboot. If they don't have goals, meaning that, hey, I'm healthy, I'm really feeling good, I'm great. You agree with them. You look at everything that they're doing, their labs, you do all your evaluations, and all you want to do is kind of retain the goodness of their metabolism and their metabolic health and their healthy aging. Then just make a quick recommendation of they should really consider doing Prolon every 3 to 6 months to trigger autophagy and support cellular rejuvenation and metabolic health. And so, once again, lab measurements on a case-by-case basis. The right parameters are dependent on your patient goals. So, metabolic balance could be body composition. You can look at cholesterol and hemoglobin A1C and blood pressure. If it's weight loss, you could do body weight, waist circumference. I know for us in our office, we use ultrasound to kind of measure body fat, and so we track it that way in our practice. And of course, with healthy aging, just looking maybe at IGF-1. So that's kind of suggested lab measures. Now, most of you, I know, are doing a lot of other measurements that I'm sure you will see improvement on as well with, working with individuals when they're applying Prolon. So, when you look at this particular slide, you'll see, so when you look at suggested lab measurements, you have counseling and education that's available. You have in-office virtual consults. So, you can look at the manual that Prolon has put together that will really help you and guide you into how to have a person participate through those 4 layers or months of the cycle. And if you look on the left-hand side, it kind of shows you different suggestions on what to talk about during each cycle, get through, encouraging them, troubleshooting them, and remember, prepare them for that day 6 transition. There's a meal guide that's provided to show you what to do for day 6. Please encourage that to individuals. I'm telling you, you're going to get a much more gratifying outcome by getting that day 6 adherence as well. And, once again, this is just going through that process. If you look at, after cycle 1, discuss the experience, find out how it is, maybe make some suggestions, discuss lifestyle changes. For example, maybe decreasing caffeine, more regular exercise. And then at the end of that 4th cycle and getting lab measurements, maybe at the completion of that 4th cycle, that's where you can either do that in-office or virtual consult with the patient. You can review the follow-up labs. And then, of course, really refine the dietary and lifestyle guides that you're wanting them to follow in order to get the goals and results that the patient is looking for. So how does it support health? Obviously, fasting affects every cell in your body. Universal stress of food deprivation triggers self-preservation. That's that autophagy process. Nourishes the body while keeping the body in a fasted state. That's Prolon. And it's distinct from taking a daily supplement because, fasting mimic diet activates a synergistic response in multiple mechanisms that trigger cellular stress resistance pathways. So it's different than taking, I'm taking CoQ10 or, I'm taking resveratrol. You're getting multiple metabolic pathways that are helping with that cellular rejuvenation signaling and, of course, the induction of autophagy. So I got that done right on time so that we can answer questions. But if you want to learn more, please go to prolonpro.com. If you have not done Prolon for yourself yet, I would highly suggest that you try it. I think you'll find it gratifying. And I'm glad we got done on time, and enjoy the day. Let's see what we've got. Misha, are you going to be answering the questions? You are answering the questions. Perfect.
Thank you, Dr. LaValle. So we've been responding to the great questions from the audience in the chat, but I'd like to pass on the mic to you, Dr. LaValle, and respond to some in person. We have 2 open questions.
Sure.
One that will be covered by another team member, but if you'd like to address the question regarding the 1 teaspoonful of allowed salt.
Yeah, it's not as a hypertonic solution to take a shot for GI health. It's simply, you could apply that teaspoon of salt daily in order to flavor. Can I register if I live in Mexico? That is up to you, Misha. I don't know the answer to that.
I have an answer for that. The question is, you can register as long as you have a U.S. address for the shipping of the program.
Oh, there we go.
I'm going to send you my email so I can help you with that.
Perfect, Antonia. Thank you.
Thank you for this question. So Dr. LaValle, we have another question regarding doing Prolon monthly. There was an earlier question and we discussed the 3 consecutive cycles that individuals do. Is there a problem if individuals want to continue doing Prolon monthly?
Every month?
Correct. That's
I mean, it's not what was suggested in all the research. So I don't want to go against what is recommended. So let's go back quickly to this beautiful slide that recommends how to do Prolon. So if you look at this, it would tell you that basically you may go here, for example, 4 cycles and then do 2 more, then reassess. But basically, my suggestion is that, once you get past that 6 cycle part, doing it every, 3 months is probably going to be adequate. I would defer to the science team at L-Nutra to make a firm statement about the monthly use of Prolon. So I would rather defer to that group to answer that question.
Thank you,
Because
Dr.
it's kind of not it's not what's recommended in any of the literature. So I tend to stick with what's recommended in all of the literature from Prolon.
That's correct. So on behalf of the medical education team, we also share that the participants in our published clinical trials underwent 3 cycles of Prolon in consecutive months. We do defer to you and your medical expertise regarding the optimal frequency. You may want to recommend doing monthly cycles until your patient reaches individual goals, and then every 3 to 6 months thereafter to maintain long-term benefits. But with every cycle, the minimum time in between is 25 days. Okay, we have another question, Dr. LaValle. We actually have a few coming in. So what is your take on patients over 65 doing Prolon?
I don't have a problem with someone over the age of 65 doing Prolon. I think if I remember correctly, where there's a little bit of a caveat for not recommending is those over the age of 85. Is that correct, Misha?
So we actually have over the age of 70 where we recommend being under direct supervision of their healthcare provider.
There we go. That's a new recommendation. I'm glad that question was asked. Now I know. Fantastic.
Thank you. I want to be mindful of time. I do see we have a lot of questions coming in, so I'll try to choose the one that covers multiple questions. Some people are asking about some adverse effects like bloating and constipation. Dr. LaValle, do you have any recommendations or thoughts about that?
Well, I think that, look, no matter what program you have, especially people in our population that come to people trained at A4M, we've got a lot of guts that are quirky. And I think you're going to occasionally get somebody. Now, with the reduction in inulin in grains, I think that infrequent complaint is reduced even more, because I think in the population of the folks that we typically will see, that maybe the inulin in some of the folks was bothering them. But I mean, I think you're going to occasionally run into someone that may have that issue. All I can do is kind of go on my experience with it, which is I'd say fairly substantial. I mean, I've probably done this with a few hundred people at least. And I don't generally see that problem. Every so often, someone will tell me that they bloated, and it could just be a particular sensitivity to one of the ingredients.
Thank you so much. So unfortunately, we're out of time. We are going to get back to all of the medical questions that were asked, and I've left our medical education email address in the chat box below. With that, I would like to thank Dr. LaValle for presenting this webinar on the science and clinical application of the fasting mimicking diet. We thank you all for joining and hope that you had interesting takeaways from this and look forward to staying connected.
Thanks, everybody. Have a great night.